we've seen a lot of progress in lung cancer in general over the last several years, both for metastatic lung cancer and more recently for earlier stages of lung cancer, including with advances through trials like this one, CheckMate 77T. This represents a big problem in thoracic oncology. Um, Historically, early stage lung cancer, meaning diagnosed at stage 1 or 2 or 3, um, despite the intent of the prior treatments to try to cure patients of disease, unfortunately, a large percentage of lung cancer would recur after surgery in many cases. And so, um, for a couple of decades, the standard of care was surgery and then giving a few cycles of chemotherapy after surgery, what we refer to as adjuvant therapy. But with the emergence of immunotherapy with immune checkpoint inhibitors initially approved in metastatic lung cancer, now we're seeing a lot of trials where these immunotherapies are being tested in the perioperative setting. So we've seen a lot of trials where immunotherapy was administered only after surgery. These are several adjuvant trials. There then were the trials of giving immunotherapy in the neoadjuvant setting, so prior to surgery, either alone or in combination with chemotherapy. And more recently, we're seeing these perioperative immunotherapy trials be presented and published. And so this is giving immunotherapy with chemotherapy before surgery in the neoadjuvant setting, then proceeding with surgery, and then continuing with immunotherapy alone in the postoperative period for a year in many of these cases. So we've seen trials such as this one, CheckMate 77T, as well as other studies with relatively similar designs. For example, the Keynote 671 trial, the Aegean study, are sort of similarly designed phase 3 trials using perioperative immunotherapy in early stage resectable lung cancer. So what this trial, CheckMate 77T, and others are beginning to show is that an approach like this, using chemotherapy and immunotherapy before surgery and immunotherapy after surgery, significantly reduces the risk of recurrence as patients are followed more longitudinally in these trials. We're seeing a clear separation in terms of how often the cancer tends to come back or not, depending on whether patients were randomized to the arm of the trial, including immunotherapy, or to the other arm of the trial, which was a placebo, where patients only received chemotherapy before surgery, but did not receive immunotherapy before or after surgery. So, I think this is a really exciting development in lung cancer and specifically in early stage lung cancer. Several of the trials will continue to have follow-up. We've seen in a different trial, the Keynote 671 trial, which was very similar, but using a different immunotherapy, pembrolizumab instead of nivolumab. That trial has also reported that patients who received immunotherapy on the trial had significant improvements in overall survival, not just what an earlier endpoint is event-free survival, meaning essentially chance of recurrence. So we are seeing that these approaches are helping patients to live longer and increasing, we hope, the cure rate for patients with early stage lung cancer.